All right. Hello, everyone. I want to welcome you to the Health Policy and Management session. My name is Wendy Hicks, and I'm the Assistant Director of Recruitment and Admissions. And I'm here with the wonderful department representatives for our Health Policy and Management department, as well as a current student. So I'm going to turn it over to Ms. Kathy Wollenzine, and she'll do introductions.
Hello everyone, my name is Kathy Wollenzine and I'm the Academic Advisor for Health Policy and Management. And along with me, I'll turn it over, we have our faculty member, Sarah Blake.
Hi everybody, again this is Sarah Blake. I'm a professor here in the Department of Health Policy and Management, and I'll lead us through in a few minutes to learn a little bit more about the program, and we'll all be here to answer the questions for you.
And we also have Meredith Yinger, one of our second year students here in HPM. And so she'll be able to give you her point of view because we'll go over the details of academics and what classes you'll be taking, but she can speak from the student's point of view, which will be very helpful.
Hi, I'm Meredith. I'm a second year student in the department, and I'm excited to answer your guys' questions and tell you more about my experience here at Rollins.
Great, let's get started. So hopefully you can see on the screen, we want to tell you a little bit about the department. Our department's curriculum is really interdisciplinary. The field of health policy and management is interdisciplinary in nature. And our program really provides students with a comprehensive background in the conceptual and analytic knowledge that's really necessary to understand and improve the health status and health service delivery. Our faculty are also interdisciplinary. We have experts in the fields of health economics, healthcare law. We have professors who are sociologists, political scientists. My own background is in public policy. We have physicians who have a background in both general medicine as well as psychiatry. We also have faculty who are experts in the fields of healthcare finance, operations, and management. On this slide, we want to be able to spend a few minutes to let you know that you have a few options in terms of your master's degree. We offer both an MPH program, or MPH degree, but you can also choose an MSPH, and I'm going to go over those two options right now. So for our MPH program, it is a 42 credit hour program. We offer a 2-year track for students who are interested in either health policy or who want to choose healthcare management. There is a 12-month option. It's an accelerated option for healthcare management students only. So this is a 3-semester, very intense and accelerated track. So you come in the fall of your first year, take classes, and then graduate in the summer of the next year. So it's 3 semesters. All of the MPH program students have a capstone requirement. So in their last year of their program, whether you're health policy or healthcare management students, you will have a capstone, 2 capstone courses. One, if you're in the 2-year program, you have a capstone in the fall and a capstone also in the spring semester. The capstone really reflects a culminating experience. So it really kind of allows you to accumulate your knowledge, bring it together, and usually there's a capstone project. So it's either a paper or a group project that you will finish. But that is a requirement for all students who are in the MPH program. The capstone for our 12-month accelerated students occurs in the summer semester. The MSPH program is a different program in that it really is preparing students to have a career in research, and usually in health services research. For this program, it is a little bit longer or has more credit hours. It's actually not longer, it's two years. You do complete 48 credit hours, and the reason for that is that we have a few more classes that are geared toward helping you complete a thesis. The thesis is a requirement for our MSPH program. You take, we'll talk about the actual curriculum in a few minutes, but for the MSPH program, you are taking specific classes that help you prepare for completing that thesis. So it is a 48 credit hour program with a thesis requirement. All students, whether you're in the MPH track or the MSPH track, are required to complete a practicum. A practicum is the same thing as an internship, so the same kind of idea. Our HPM practicum applies knowledge and skills acquired through your coursework in a community-based environment. An ideal practicum should relate to your academic or professional interests. It also includes very well-defined competencies, learning objectives, and a process to track and evaluate student performance, competency achievement, and practical experience. Because the idea of a practicum is to really apply what you're learning in the classroom to the real world and to be in the field, we require that you have a primary supervisor that is qualified, is considered a qualified field supervisor. That's usually a public health practitioner or someone that it can serve as a supervisor that's in the position or in the organization that you're working in. That field supervisor will evaluate your performance in the practicum and be designated as the person who will oversee your work during that practicum. In terms of what options you have, there are a lot of potential opportunities here. As you may already know, we have the CDC right next to us and many public health agencies and other organizations in Atlanta. We are the public health capital of the world. And our potential opportunities, again, are in local and state public health agencies. They can also include national, international, even local non-governmental agencies and organizations. So there are a lot of opportunities, and you will be assigned a practicum advisor that you will meet with in the second semester of your first year to learn more about the opportunities. One of the things we just want to make sure is that you are required to work a minimum of 200 hours for your practicum. However, many of our students go up and beyond those number of hours and even up to 400 hours. Again, the idea is that you're working in the field, in an organization that allows you to really apply what you're learning in the classroom to the real world. And you will also work with Kathy Wollensing, who is our ADAP, and also your practicum advisor, to make sure that you're following your practicum and following the paperwork that's necessary. We have lots of other school resources that can help you with finding a practicum. We have a career services department. You may also be able to use your REAL program, the Rollins Earn and Learn, which is a program here that's a wonderful opportunity to work part-time while you're also a student. There's also community engaged learning as a resource for you in order to find a suitable practicum. And now I want to hand it over to Meredith to let her talk a little bit about her experience as an HPM student.
Hi everyone. So again, this is Meredith. I'm a second year student. I'm on the policy track. So I'm focusing my studies kind of in policy, but I've taken some management courses. I TA'd our management class. And so I do know a little bit about both tracks. I am super interested in aging, disability, long-term care, and chronic illness. And so I've kind of tailored my experiences as a student at Rollins in my real job, in my practicum, to that interest. I did my practicum, this is complicated, but I was an intern with the National Academy of Social Insurance, and they placed me at the Social Security Advisory Board to do my actual internship. So I was there for about 40 hours a week. The Social Security Advisory Board is like the smallest government agency ever, and it works for a bipartisan politically appointed board. And the board tells the Social Security Administration what they're doing poorly, how to fix their issues, and gives Congress more information on how to enact legislation. So I did policy research for them on a couple of Social Security policy issues. It was a really good experience for a number of reasons. I would say the best thing was the networking. So I was in Washington, D.C., and I had the opportunity to meet some really, really important, amazing, smart, cool people who work in this field that I'm really interested in, and the kind of understanding how people create actual policy memos in a workplace and present those to your superiors, and I presented mine to the board, was really helpful for me to kind of understand how to apply what I was learning in school to my future career.
Thank you, Meredith. And we'll have an opportunity if you'd like to ask Meredith any specific questions about her experience as a student after we complete this presentation. So now I'm going to hand this over to Kathy Willensine. We're going to spend a few minutes talking about the curriculum model so that you will be able to get a good idea of the different options you have for our graduate programs.
Hello everyone, this is Kathy, and I want to start off first off with our healthcare policy chart that you'll see in front of you. First off, for those students who are here on the line, if you've been accepted into the MPH program or interested to apply, upon acceptance into the program, you're eligible for the policy or the management track. That would be the 2-year and the 1-year accelerated. If you're interested for any reason in the MSPH, please let me know after this, and then we can evaluate that. Our admissions committee reviews the MSPH program separately. All students entering the program will declare the track that they're interested in, and so the first fall semester has identical information and coursework in the first fall semester. So when students are here, when you get ready to pre-register for the following spring, I will meet with you all, and you all can say for sure if you have changed your mind to policy or management. So that's why the first semester is the same on our grid for the fall semester for policy and management. And then moving on with this policy chart, the spring semester, you can see the coursework changes there. We bring in a cohort of around 90 students per year, and it breaks off into being approximately 50 choose management and 50 choose policy, which includes the 12-month accelerated management and the MSPH, which falls under the policy track. So it always does, give or take 1 or 2, it's a 50-50 split. And students, as we mentioned earlier about the practicum, you are allowed to start your practicum during your spring semester. So you have to have 1 semester of coursework, so your fall semester, to have coursework under your belt to apply that to the practicum starting in the spring semester. Also, you're allowed, let's say for example you have a position as Meredith did over the summer, you may want to do something different while you're here in school. During your spring, you can start counting hours. You can choose a different assignment for your summer and then follow up the following fall and spring as well. And it's very easy to accumulate 200 hours, as Sarah had mentioned earlier, but you can combine 2 sites to equal your total hours. And then again, you have 2 capstones in this course, one in the fall and one in the spring. And then the next slide here is the 2-year outline for the management track. You again see your first fall semester is identical, and then it breaks off in the spring, and you have a coursework requirements there, and then you have a freedom of electives. And on that note, I want to explain that HPM offers a list of electives. You're allowed to take your electives in HPM or in other departments, as well as we are provided a list from other schools across campus, from the business school, the law school, and non-clinical from the nursing school. So it's a great opportunity to broaden your field of interest. This next chart is your 12-month option, so you can see this is exactly the same as the 2-year management. It's just more compact, and you complete it over 3 semesters, fall, spring, summer. The total requirement is 42 credits. You're able to start working toward practicum hours during the spring and then complete them over the summer. And we have the summer structured where the classes are on Mondays and Tuesdays, so your Wednesday, Thursday, and Friday are open in order to actually have a practicum over the summer. Students interested in this program, the cohort will vary from 10 to 15 students in the summer that will take this class, and you'll be mixed in with the regular 2-year program for the fall and spring, and then you'll have the smaller cohort during the summer. And then here is our chart for the MSPH. This is a cohort of 5 to 7 students. This has a stronger quantitative base, and as Sarah mentioned earlier, this has a thesis requirement. So you can see the layout of the program. The classes colored in pink are the ones that you still will mix in with the MPH students on the policy track. However, everything marked in the yellow tone are individual classes, so you'll work closely and have such a good relationship and establish your faculty team that will be your advisors.
Okay, great. Thank you, Kathy. We always get questions about employment, and so we wanted just to give you a snapshot of some of the jobs that our alumni are offered and take upon graduation. We have a very strong graduation placement rate, and as you see here for our MPH alumni, our students in the recent past have taken positions both in policy and in management. Deloitte is a consulting firm. The Government Accountability Office is a government agency that does a lot of program evaluation work. So we've had a number of policy students take jobs and actually internships at the GAO. Humana, Kaiser Permanente, health plans, those are organizations that both policy and management students have been placed in. The Department of Health and Human Services, this is a federal agency that employs funds many other agencies, public health agencies, including the CDC. So that includes CDC, it includes lots of different federal agencies that our students are placed in. And then here at Emory University, we have a very strong and wide network of healthcare clinics and hospitals. Both policy and management students have been placed at Emory Healthcare. More of our management students have been placed there to do more administrative leadership positions, but that's also an option for you here and in other healthcare clinic settings as well. In the second column, as I mentioned before, the MSPH program really is geared for students who are have some prior research experience but have come into the program to advance their research skills in the hopes of either moving into more senior analytic positions or are considering a terminal degree such as a PhD or even an MD. So as the list here shows, we've had students in the MSPH program placed at the Centers for Medicare and Medicaid Services, the federal agency that oversees both of those national programs. We've also had students placed at high and very competitive research firms such as Impact International. Here in Georgia, we have a health policy center that employs research analysts, and they do a lot of work for the state to do data analysis and health policy analysis for different agencies here in Georgia. And then we've had a number of students who've gone on to get their PhD. University of Minnesota is one, we've had a couple of students go on to Brown University. And then we've had a student, just as an example, that wanted to move into more healthcare management and research within the healthcare setting, and so we had a student who went to Emory Healthcare doing quality research work in the organization. So these are just a few options, and then we've had students. Again, our placement rate is very high, and you have a really wide range of employment opportunities available to you upon graduation. One thing we wanted to mention is that you may already know that you have an option to really focus some of your studies around key public health issues. And so Emory, our Rollins School of Public Health, offers a number of certificate programs, and they're listed here. They're all, again, really centered around key public health issues and topics. Ones that are very popular for our HPM students tend to be the Certificate in Mental Health. That is actually led by our professor, Ben Druss, who is a psychiatrist by training and is a very nice and very well-funded mental health specialist, and that's a really popular program. The Certificate in Socio-Contextual Determinants of Health, if you're interested in health disparities, that's also a very popular program, a certificate program for students who want to look at health disparities. I'm going to highlight also one other, which is the Certificate in Maternal and Child Health. This is a very popular, very competitive certificate program. It is the only one in which you need to designate in your application and apply for as you go into SOFIS. I believe they take only about 20 students. As I mentioned, it is competitive. They do offer some scholarships as well. So if you're interested in any maternal child health or women's health, this is a very good program for you to consider. But these are all available to you. You can designate this either in your application, or if you're interested once you come, if you're coming for visit Emory, or if you're coming at the beginning of the fall semester, you can learn more about how to enroll in these certificate programs. I think we're at the end. That is my contact information. I think I forgot to mention that I am the director of the MPH and MSPH program. So if you have any questions that I can answer for you from a faculty perspective, please feel free to email me. That is Kathy's email as well.
All right, and so we are now, this is Wendy. We are now going to open up the floor for questions. So if you'll type your questions in, I will read them aloud and we will respond accordingly. So let's see. Virginia wants to know, how big is the cohort for the 2-year HPM program?
Approximately 90 students enter the program, and we'll have a 50-50 split between management and policy. We take around 10 to 15 students in the 12-month accelerated, and then there's 5 to 7 students in the MSPH program. So overall, it varies from year, 88 to 95, so around that size.
All right. So the next question is, I want to do a certificate in mental health. Can you talk a little bit about that? That's where I'm highly interested.
Sure. As I think I just mentioned, it's a very popular program. It's a program that allows you to sort of specialize your electives in mental health, led by Ben Druss. It is interdisciplinary, so it's not just HPM students who take this certificate program. They do some really interesting work. There's a class that they've just created that is co-led by some behavioral health sciences faculty to do case studies in mental health, some problem solving, and it's really wonderful. And they bring a lot of mental health experts into the classes. So it really is hands-on experience and understanding about public mental health issues.
Great, thank you. So we have 2 questions that are similar. One specifically saying how many certificates can we do, and the next that asking if you can do multiple certificate programs.
This is Kathy. I've had students do 2 certificates. Now, what you have to realize, you're all little overachievers, and you like to do everything. Meredith can say this, but there are limitations on how many certificates. I would say top max would be 2. Ideal is just to do 1, because what you want to do is to have the opportunity to absorb the material you're learning. You all have a tendency, students, you can see I do advising here. So students have a tendency to want to take everything. And so it's nice if you want to specialize in something, pick what you're interested in and go for that. And so it seems to work best with 1, but I have had students do 2, but it'll be based on the 2 that you choose, because there's requirements for each certificate that have to be met. The practicum needs to be relevant. The coursework has to be taken. So I can help walk you through that.
All right, so our next question is it possible to change your program after you have already been accepted, like switching from global health to health management?
Yes. What you'll want to do is let us know. It's ideal for students to start in the appropriate program. It pays off for you in the long run because, for example, HPM, our first semester, as you can see on the charts that I showed you earlier, the first semester is all required courses. So if you're in another department and you say in the spring, I'd like to switch, well, it throws it off. So it's not a good thing, and chances are to switch programs at that time. But at this stage in the game, you can certainly switch. Please email me, and then I will put you in, also copy the current program that you're in, and then we will have admissions send us the file, and it will be reviewed by the admissions committee in HPM, and then we can make the official switch once you're accepted.
All right. So do you have any students who choose to do a dual JD MPH? If so, which track or degree have they chosen historically, and what are some considerations I should take into account when choosing?
Yes. So we have students that do the dual degree. I happen to be the dual degree liaison for Rollins, so I work with all the departments on the dual degree options. For the JD MPH, what you'll need to understand is you'll need to apply to the law school and be accepted to Rollins. You start year 1 at law, and then you come here for a year and then return back to law. Every dual degree is organized differently, so there's details that will be relevant to those. We always have 3 to 5 students that are in the law school that are doing the dual degree, but sometimes they're here they'll be here year 2 and then they're back at law. And so I can certainly put you in touch with one of our current students. And there's also a new option called the JM, which is a Juris Master's. So you can complete your public health degree, and then if you're interested in doing the dual, you can do that at the end of the public health degree. But if you're interested in doing the JD MPH, you must start at the law school first.
Hi, I've been accepted to the MPH program, but I am keen on the accelerated programs. How does the selection work?
So I assume you mean the accelerated management track. You're automatically accepted into the 2-year program or the accelerated. If once you make your decision and make your deposit to come to Rollins, I will reach out to you personally and say, okay, you're interested in the 12-month track. I will add on one extra elective for your enrollment for the fall. And the program is structured fall, spring, summer. If you wish to switch out of the 12-month back to the 2-year, you have to do that in October of your first fall semester. But if you're interested in doing the 12-month, you must start on that track because and a lot of students confuse this. The 3-semester 12-month program costs exactly the same as the 4-semester. It's just tuition divided over 3 semesters as opposed to 4. A lot of people think, oh yeah, it's a semester cheaper. No, it's not. It's exactly the same, so just be aware.
All right. Can you talk about the religion certificate? What classes do you take and why do students usually do this certificate and what jobs do they go into?
The religion certificate, I would have to get the specifics. There is a link online. You can certainly email me after this webinar and I can provide that for you, but it will tell you the exact coursework required for religion. The religion certificate, we have a dual degree offered with the Candler School of Theology, so some students may not want to pursue the dual, but they have an interest in that specific field. Most students, when you think of it, you're coming to public health, faith-based, healing. There's a lot of different aspects to the religion degree that people find an interest. So, but your degree would be an MPH, so you would target a place you may wish to work and then apply your area of interest based on electives or the certificate.
Is there a practicum related to mental health?
Absolutely. We actually have a wonderful organization called the Carter Center. That is, you may know of the Jimmy Carter Center, and they, a number of our faculty have projects with the Carter Center, and Dr. Druss also is jointly appointed at the Carter Center. That is one place a lot of our students tend to do their internships. But there's opportunities at different public health agencies to do that, to do mental health work. Also, there are a number of faculty in the university that are doing mental health research. Dr. Druss is one of them. He has a very large grant focusing on the mental health, healthcare needs of underserved populations. So there's a number of opportunities to do mental health work for your practicum.
Thank you. So in regards to the MPH JD, how do you think that both degrees would work together with the HPM concentration?
So if you do the JD MPH, you're planning on practicing law. So the major difference between the JD and the JM is a Juris Master's, just gives you some knowledge in law. If you're going to do JD, your main degree is pursuing to practice law. So that you would be accepted to both, and then you would be placed in the policy track as based on the dual degree. So you would do policy, and that goes in alignment with the law degree.
Okay. So one student is planning on pursuing the PhD. So is it possible to change from an MPH to an MSPH? And is there anything that they can do now?
Yes. Hi, this is Sarah Blake. If you are interested in the MSPH, the one thing you want to do is you want to contact either Kathy or myself, indicate that you've been accepted into the MPH or that you've applied for the MPH and you'd like to be considered for the MSPH. We will send your file to the admissions committee and we'll let you know upon the decision that is made. So you do need to let us know, contact us if you've already applied that you want to switch to be considered for the MSPH program.
Okay. One student was curious how Career Services helps, or how do you all help with employment? So what would be that process?
This is Meredith. I can talk about that a little bit because I'm working with Career Services and trying to find employment right now. So our Career Services department is one of the main reasons that I decided to come to Rollins. We have our own Career Services department for the School of Public Health. We don't share them with any other school. And I think we have the biggest career services department in public health, like ever. So they're really great, and they can kind of like cater to your needs. They do a couple things. You can do like one-on-one meetings with a career counselor that are really useful. They'll go over your resume with you. They'll do mock interviews. They'll talk to you about your interests, suggest some places to apply for practicums or for general employment. They also bring in a lot of employers for info sessions, which is really great for a number of reasons. One is just for exposure for the kind of things that are out there, to meet people that are Rollins alumni that work at different firms or agencies now. And we also have a career fair every semester. So our spring semester career fair is actually tomorrow. And they bring in about 60 employers a semester to talk to students about potential future employment, internships, things like that, which is just really useful to kind of, for a ton of reasons again, but partially just to learn how to talk about yourself in that kind of high pressure setting. So career services is really great.
Right. Can I audit courses in the policy track if I'm a candidate in the epidemiology track?
Yes, when you're a student at the Rollins School of Public Health, you're welcome to take electives in other departments. We have what's called satisfactory, unsatisfactory option. That means it counts towards your total credit hours. The term audit that you're using, you would have to check with the professor to make sure that there is room in the course and receive approval and bring that back to your advisor. So there's an advisor like me in the EPI department, so you would let them know if the HPM professor approves it, and then you're allowed to audit.
All right. Is there a joint program with an MSW?
No, we do not offer that here at Rollins.
Okay. What are the hours of a typical class schedule, such as classes from 9 to 5?
Meredith?
This is Meredith. So it's going to depend a lot on the semester. So our classes in HPM are typically between 2 to 3 hours a week. And a lot of the time they're like all 2 or all 3 hours at once. So we had, my first semester, we had a lot of morning 9 to noon classes. And then the Introduction to Management course is at night because that professor works full time. And then there's like a 1 hour biostatistics lab, and our biostatistics class was twice a week in the afternoon. So that's pretty much like your most packed semester. The rest of them are kind of like more to your discretion. I would say right now my schedule is mostly long morning classes again, so those 9 to noons, and then I have 2 night classes also. So it kind of just depends what you decide to take. The classes totally span the gamut in terms of time and length and number of credit hours. So.
All right. And a student had a clarification question regarding a practicum and a thesis. So they are not both required for the MSPH, right?
So the practicum and the thesis is required for MSPH students, yes. All students, regardless of track, must complete a practicum at a minimum of 200 hours. The MSPH program, as you can read, is 48 credit hours, so it's longer because we are preparing you for that thesis. You must complete a thesis in the MSPH track. That is not a requirement, however, for the MPH students.
Thank you. Is the MPH the more desirable degree for a DRPH or a MSPH?
If you are thinking about a doctoral program in this field, and you have the research background or quantitative, we really focus on your quantitative skills for the MSPH. I would advise you to take the MSPH. That will prepare you best for a doctoral program.
So do you as a department assist in placing students in the internships, or is that something that is their own responsibility?
It's the responsibility of the student. However, we provide excellent resources. All students are assigned to a practicum advisor, so you can meet with them to get their point of view, and they're out working in the field. Also, as Meredith mentioned, our career services, they post positions on, it's called Handshake, and any job that is through Rollins that has been posted will be out there. And then also a student can pursue employment on their own. So you can just look at that there's a certain company you're targeting, but the resources here, all students are assigned a faculty advisor, a practicum advisor, and then you have me as an academic advisor, and we have career services. So the opportunities are there, and we provide you a list of where students have gone in the past, but you do not have to utilize that list. You can certainly branch out and go in a different area if you wish.
I'll also add career services has like this thing called Handshake, which is a database where they post like every job you could ever need. So that's also really useful, and you can apply for jobs directly through that database, and it's people posting that are looking specifically for Rollins students. So that's a really good resource.
Okay. When would you choose the track you're in terms of policy versus management?
The first semester is identical for policy and management. So some students come in and are sure that they're going to be on the policy track. But when we start to pre-register for the following spring, that would be in October, at that time you have to declare your track so that we'll enroll you in the appropriate management or policy track.
There's a student who has been offered admission into the HPM program. Congratulations. She wanted to follow up with you about clarification regarding exploring other programs through coursework. So is the best thing for her to do to email you? Or
Yes, you can email me, but you're welcome. If you're interested in taking electives in other departments, you're more than welcome to do that. But feel free to email me any specific questions you have.
Okay. Do you have many students who join immediately after receiving their undergraduate degrees, or do you prefer students who take a few years off to gain work experiences?
It will vary across the board. We get students straight from undergrad. Our coursework is structured, as you can see in the first semester. It says Intro to Economics. We will have students that may have 3 to 5 years of experience that'll be in the classroom, but then there'll be students that have not had any exposure to economics. So you will get up to speed, by the first couple of weeks of class, but it is just a combination of both.
And I would just add that for the MSPH program, that our students typically have a couple of years of work experience, either in a research position or some prior research experience in a job that they've had. So we do look for job experience when reviewing those applications.
Okay, so a student is asking what types of opportunities are available in the maternal and child health or women's health field. Is this something that's related to HPM?
Yes, well, that actually happens to be my area of expertise, and I do a lot of work in maternal and child health. Y'all just sit back. Thank you for asking that question. So again, students are in the certificate of they come from in maternal and child health are across all fields of public health here at the school. We have, if you're an epidemiology student, you might take a job. There's an MCH Epi program actually at the CDC. So it really depends. For HPM students, we tend to get students who want to work in health departments, maybe wanting to work in maternal and child health programs in general, doing health policy analysis. In my work, my research focuses on reproductive health and maternal and child health. I do a lot of work that's funded by CDC, different foundations. I happen to work for a foundation here in Georgia that looks at public health initiatives to address adverse infant health outcomes. So I do a lot of evaluation work for public health departments to look at how they're trying to address our very poor birth outcomes, including prematurity and preterm birth. So if you're interested in just knowing more about the research that we do, Kathleen Adams is a professor here who also focuses a lot on maternal and child health. She's a health economist and does a lot of work on Medicaid and how Medicaid addresses maternal and child health. A really exciting thing that has happened in the past year here at Emory in the School of Public Health, we have established what's called RISE, R-I-S-E. That stands for the Center for Reproductive Health Research in the Southeast. This is an interdisciplinary research opportunity for students to learn about how to do reproductive health related research, and we include maternal and child health in that definition. So we did have some opportunities for students to work at the center on reproductive health and maternal and child health issues. So I'd be more than happy to talk with you about those opportunities as well. But overall, we also have, I should mention, in the EPI department, a Center for Women and Children that is led by Carol Hogue, who was a CDC leader in maternal and child health and continues to be a leader in public health. And that is an opportunity, again, to gain some experience specifically in maternal and child health. So you're in the right area if you're interested in learning more about doing maternal and child health research in particular.
Okay. We have two students who are curious about the difference in management and policy with the global health program and if there is a practicum related to global health.
Okay, so what we have here, you're asking if you can do something globally as a practicum? Is that what the question is?
Kind of.
Okay, I'll just go on that. So students, if you're management or policy, there's a whole list of different items that you can choose from in companies to do a practicum. If someone wants to have a global focus, we have a great opportunities for students. It's called Global Field Experience. And so students are allowed to go abroad, and they can even apply to get money to funding to take this opportunity. So that's a great fit for students, whether you're management or policy. We're two separate departments. There's an HPM department and a global health department. However, you can certainly cross over, choose electives, and I have students who want to have more of a global perspective, and you can choose an elective abroad as well. I mean, your practicum abroad.
And I think you're interested also in knowing about mental health and global health opportunities and whether the Carter Center or other agencies place students for those kind of practicum. And I would say absolutely, the Carter Center does a lot of global health and mental health work. And so we'd be happy to talk with you a little bit more about those opportunities.
Okay, so how does the admissions department of Rollins weigh applicants who are coming straight out of undergrad versus someone who may have taken time off after undergrad?
The admissions committee will look at the application as a whole, so they do a holistic review. So we're looking at strong GRE scores, 50th percentile or higher, a GPA of 3.0 or higher, and then strong recommendations. And we can see if you've done volunteer work while you've been in undergrad. But students that have 3 to 5 years work experience may be a little out of touch of being in the field of, back in school with classes, so they have a transition to come back to school. But students are given an equal value when they're reviewed in coming in. So if you're qualified as a student, you will be fine if you meet those standards.
Okay, so how wide is the Rollins network? Do students tend to stay in the Atlanta area, or what are other popular cities for jobs for alumni? So I guess speaking from HPM standpoint.
There's jobs everywhere, so we have it can be like we said, if you want to go abroad, but we have a lot in every state. So let's just say you're coming from Michigan and you're interested in going back to Michigan. This is where you work closely in working with career services and tell us what your interests are. I have a lot of students say, Kathy, I'm fine wherever. I'll apply for jobs. There's no limitations of where I would like to work, but some students have particular areas that they wish to live, whether it be the Southeast or California or the Northeast.
Okay. Is there a way you can do both health management and global health? I think we've covered that.
It's not, you can't, your degree will be from one department. Overall, just remember, you're going to have an MPH, which is the Masters of Public Health. Your focus would either be health policy and management or global health. But you can take your electives across departments, but you will be choosing one department.
Right. And I would say that most of our healthcare management courses here in HPM are domestic focused. We are focused on the U.S. healthcare management system. That said, I do know that Deborah McFarland in Global Health teaches a global health management course. So if you're interested in doing some comparative work, you can definitely take your elective in global health and learn more about management, and that tends to be management of public health programs. So as Kathy mentioned, you can cross-train, but you will have to make a decision about whether to be in HPM or to be in global health.
Okay. We have a question regarding after the submission of a deposit, and Is it possible to work with Career Services to find an internship opportunity in Atlanta prior to officially enrolling, and opportunities for the summer? Are there any opportunities for this summer?
There's always opportunities here in Atlanta, but you want to understand, in order for an internship / practicum to count towards your degree, you do not do it prior to starting Rollins. So you would come and start in the fall, and then your practicum hours could start in the spring semester or the following summer. So you need to do that after enrolling for the program for it to count towards your practicum hours. That is an accreditation guideline. So but there are tons of opportunities in Atlanta, and you can certainly utilize Career Services, but it will not count towards your practicum.
Rebecca is interested in advocacy much more so than policy analysis. She'd like to advocate for the underserved populations. So would you say many students pursue and find employment in this area?
That's a great, it's really interesting. We've had more and more students express interest in doing health advocacy. We do have a number of students that are interested in that and are finding themselves working for nonprofit organizations, taking roles where they're doing some support, advocacy support, either through research or through just support by being in the organization. We do have opportunities to take courses in advocacy. Just from a teaching perspective, I'll let you know that I have actually myself, and I've come from an advocacy perspective. That was my job before entering the field of health services research. So I actually bring in advocate trainers to my classes to tell students and teach them some advocacy training skills. So we are doing more and more to make sure that students are, since we've heard from them, are learning those advocacy skills. And there are also opportunities to take part in student organizations, which I think, maybe Meredith can talk about in a little bit. There are a lot of opportunities to learn and build those advocacy skills by being part of the student organizations as well.
So in regards to the student organizations, I don't know the exact number, but we have a huge number of student organizations here at Rollins. More than any other graduate school that I've ever heard of. And they focus on pretty much any issue you could ever want. So there's one program that's specifically related to cancer prevention. There's another one for primary care progress that's interdisciplinary between the med school, the nursing school, us, and probably somebody else that I'm forgetting. And so, like I said, there's student organizations for every issue, and a lot of them do a lot of advocacy work, and they're pretty well plugged into issues and events that are happening throughout Atlanta and in the state of Georgia. So that's another way you can get involved.
Okay, so what types of research opportunities are available?
Well, there are a lot of research opportunities. A lot of our students, I actually hire students when on my grants. So one of the things I would say is to make sure that when you come on board to HPM, that you get to know your faculty pretty well. You are going to be assigned a faculty advisor. I have about 5 to 7 that I meet with regularly and advise them on all sorts of issues, not just about research. But having that faculty connection is really important. You will also get to know about the research that we do through sort of, preliminary introductions. So our faculty make sure that you kind of understand what they're working on. So we do, we really value having students work with us. We think it's part of your training. So there, that's an opportunity for you to get some public health research as well. There's also opportunities just in the practicum. If you're looking for research experience, you want to make sure that if it's not necessarily in the faculty that you want to work with, maybe outside, that you're looking for those practicum where they're looking for research skills, and that where you have opportunities to build your research. So, and again, for the students who are the MSPH students, we expect them to have research as a kind of central focus of their practicum experience.
Okay. And is there a way to find, it looks like MSPH course listings at this time? So I guess where would they find HPM as well?
Yes, there's a complete list, and you can certainly email me and I can post that out. There's a catalog that will show you every class that's offered, and it usually lists fall or spring. but there is a spring schedule that's posted now currently on the website. It's open, and then it'll have previous schedule like what was in the fall, and we're pretty close to offering fall and spring the same coursework.
Thank you. Can you highlight some of the practicums that are centered around health activism or health disparities?
Yeah. So some of the practicum that's around advocacy, we have a number of students that work. Georgia. We have Georgia. What's it called? I can't even say it now. Georgians for a Healthy Future, which is a group that actually was created or led originally from one of our MSPH students. That focuses on Medicaid expansion because we're not an expansion state. They work on a lot of the sort of policy and advocacy issues, so our students go there as an example. We have a Feminist Women's Health Center where a number of our students go. It's an advocacy but also a healthcare provider site. There are a number of organizations that our students also join nationally, public health advocacy organizations that our students either volunteer their time for or also work with. So we have a number of those opportunities for our students who are interested in doing health advocacy.
Thank you. Can graduate level statistics taken during undergrad be transferred to the MPH at Emory?
All students are eligible for waivers for a class or a transfer, but if it counted for credit at undergrad, it cannot transfer in. So the possibility of a waiver is yes. And how that works is all students are to submit a copy of the syllabus of the course taken. They must receive a B or better in the class, and then I provide that paperwork to the department chair. So it would be like the biostats. The department chair would review it and say yes or no if you could waive the course. If you waive that class, then you are to replace it with any elective, not necessarily another bios class.
Thank you. Okay. Somebody has a question about, do any of the faculty research technology in health?
Yes.
Go for it.
I don't think I have any names specifically, but I have an enormous number of friends doing research for their real jobs or as other work alongside their real job and their schoolwork. And I know a bunch of people that are doing work in technology and health. It's a huge focus throughout the entire field right now, so there's always opportunities in that area.
Okay. A clarification question: when do we basically inform you about our interest in the 12-month accelerated program, or is it based on department selection only?
No, all students are eligible. Let me clarify. If you're accepted to the MPH, you may choose the 2-year policy, the 2-year management, or the 12-month accelerated. And I will reach out to you once deposits are made and the class is set, so usually by the end of June, and I will say, this is who is marked 12-month accelerated. If anyone else is interested, let me know so that I'll make sure you're registered appropriately for the fall.
Okay. A student has a question about suggestions for an applicant who plans to move to Atlanta area and take a gap year before applying. So in terms of jobs or internships or maybe other programs, what would you advise that they do during the gap year?
Well, if you're asking about a gap year that might help you prepare for the MPH program, I think anything in public health would be great. I mean, you could go work for a healthcare plan to build some, basic healthcare management experience. If you're interested in doing public health policy work, you can take a state or local job in public health. If you're interested in research and in the MSPH program, I would just make sure that whatever job you choose is something that would allow you to gain higher analytic and quantitative skills, because that is really important. As a MSPH student, you're taking higher level biostats classes. So think about sort of what you think the MPH program is going to help you do, because I think if you can sort of look into the future in a way and think about, well, that's what I want to do with my MPH program, that might help you prepare for the program a little better initially. So there's lots of opportunities here. We are the public health capital, so a lot of opportunities here in Atlanta.
Okay, so we have about 3 more minutes, so we're going to do one more question. So a student wants to know, how is Rollins excuse me, how are Rollins involved in the community? So how involved in the community is Rollins, or speaking from an HPM standpoint?
Well, I think there's students involved, and I think we want to talk first about that. As faculty, we're all I will just say real quick, from a faculty perspective, I'm very involved. I do a lot of local and state-based work, and as I mentioned on one of my a few minutes ago, I work with some public health departments, and I really believe in being in the field and working in public health. And a lot of our faculty are doing research collaboratively, not only here within Emory, but we are in the community in terms of working with Morehouse and Georgia Tech faculty. We have a big interdisciplinary research collaborative with those research universities. And we also work, within other organizations. So faculty have a lot of involvement, but I think probably what you're interested in is knowing what students do.
So from the student perspective, I would say what you should probably take away from this entire webinar is that your experience as a student at Rollins is what you make it. So if you want to be involved in the community, there's 1,000 million volunteer opportunities in Atlanta, in literally any space that you could be interested in. I spend a lot of time, I have 2 jobs right now, and I'm a TA, so I spend a lot of time working because I wanted to get as much work experience as I possibly could as a student, and while people would just take me on for fun. So it's really just like what you make it, and if you're interested in getting out in the community and volunteering, you can do that as much as you have the time for.
All right.
Well, we all thank you so much for your time today. We hopefully have given you enough information to answer some of your questions. But as you see here on that last slide, please feel free to touch base with us, send an email to either myself, I'm Sarah Blake, or to Kathy Wollenseen. We can, between the two of us, can answer your questions. I think we've talked a lot and hopefully have answered your questions. But we really appreciate your time today, and we want to thank Wendy and Meredith also for facilitating this conversation today.
Thank you. And as a note, we will have this posted on our Rollins YouTube page. You'll be getting an update from our admissions office with a direct link to it, but I should have this posted for you by the end of today. So if you want to share it with anybody or check it out, if you have more questions about something in the presentation, we'll have that posted for you. So I hope you have a wonderful remainder of the week and weekend, and thank you again for attending.